Health Focus is brought to you by National Medical Stores, NMS, passionate about your life. This is a new private mental health facility 19 kilometers outside Kampala in Bujuko. It is also the biggest so far. The Director for Curative Services at the Ministry of Health, Dr. Charles Olaro, represented the Health Minister to commission it.
To serve the people of Uganda, providing mental health services.
This private sector addition to Uganda's health system is key because it will help to provide care for some of the 19 of every 20 Ugandans that are unable to access care. Former head of Butabika Hospital, Dr. David Basangwa, explained to a group of invited guests here.
Diseases like depression and anxiety have gone up by over 25%, which is quite big.
To get this closer to you, 1 in every 8 people in Uganda is dealing with a mental health problem. This is why more facilities are a necessity.
Suicide has increased. The number globally is about 1 million. But what worries us is that out of every person that has committed suicide, about 20 behind that one have attempted, but have not succeeded.
Recent studies conducted in Uganda revealed that 14 million people have some form of mental illness, which if left untreated, could progress to severe disease like bipolar disorder.
Previously, we have had troubles with these facilities being only in the urban areas, especially the private ones. But now, I'm glad with the safe places that we are beginning to fan out. I would consider this semi-rural or rural, I don't know. But at least the point is that we've moved away from the city to now some far places so that the services are clearly available to those that need them.
The Director for Curative Services, Dr. Charles Olaro, says they have noticed a new habit that is quickly affecting the mental health of Ugandans.
Is the aspect of internet addiction. One is one of the key mental health challenges, which if you look in terms of numbers, how many do we see? The year before, we had seen 965. In 2020, 2021, the number increased to 1,548.
And therefore, with the addition of this new facility, Dr. Olaro believes it is an intervention in the right direction.
You find other countries, you find that you need just a place that people can go and sit, meditate, and probably some music, some art. So I think those are all things which we need to do. All those ones are healing. It's not just about medicine alone. It's about those small things which matter most.
But for the proprietor, Janet Kantalama, this new facility has 50 beds to give a calming experience during recovery for any patient.
20 female and 30 male, and it's going to cater for substance use disorders, including alcohol use disorders, as well as neurological and mental illnesses.
However, the facility still requires more support to fully operate.
You can see that we are barely furnished. We still have some furnishing needs. We need more maybe medication, supporting medication, of course advice and expertise, continued support from the Ministry of Health.
On Thursday, while addressing guests at the launch of a new HIV self-test kit, Health Minister Dr. Jane Ruth Acheng stressed the importance of the private sector towards improvement of health service delivery.
In which the private sector is a key stakeholder in the scale-up of interventions for disease control.
Walter Mwesigye, NTV. National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.